Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Some really interesting questions right now. Thinking about going back to school. Dr. Bob, what do you suggest as the best lunches and breakfast for back to school? Let me tell you something. I would actively engage your students to participate with you to make their lunches. I learned a long time ago with my son Dr. Anthony and my son Dominic. It was going to be my duty to help make lunches. I decided if I could teach them to make lunches, I would get out of that activity. So here's what I'd suggest you do. Take them grocery shopping. What should they eat? You really want to back off on the bread because I have noticed over time that gluten can cause a lot of allergy issues. You can make a hamburger patty or a chicken patty or a chicken thigh and you can make that available to them. You could try maybe some coleslaw or some kind of other cold salad, like even a pasta salad with rice noodles. For breakfast, you can always have an egg, very simple. Consider a sweet potato with cinnamon on it and some almonds. So I want you to think mid-glycemic foods for breakfast and for lunch. Dr. Bob, I noticed the G on one of your label videos that you recently did. What is an alternative? Well, that's a very loaded question. We use Celtic sea salt, BioMulti Plus, and something called Amino Quick Zorb. And if you were to email us at customercare@druglessdoctor.com, we can send you the formula that we use. We do not promote G. Just look at the ingredients and you'd go, gee whiz, how is anybody consuming that? Interesting question. How can I stop leg cramps? Leg cramps at night are usually a body signal to me that you need calcium. Leg cramps on walking, if you also experience low back pain, could be spinal stenosis. Leg cramps just hanging out during the daytime when it's really sunny and you're sweating could be a mineral need. Dr. Bob, my sister and I have cysts breasts. What do you suggest? Well, very interesting you bring that up because somebody just talked to me about that the other day. We have a liquid iodine and you can put a drop or two on your breast and massage the iodine into your breast. Actually, all the women watching me everywhere in the world right now, that'd be a real wise, long-term way to prevent breast cysts. Dr. Bob, are there any options other than a steroid shot or surgery to fix a trigger finger? Yes, B6. The best way to see how much, if you need B6, is to have liver enzyme studies done. Low liver enzymes usually body signal that you need B6. Last question. Dr. Bob, I'm so interested in your opinion on a bone spur on my back. It's causing weakness in the left leg and foot. I love what you have to say about the human body. And giving up dairy as you recommended has really helped me. Thank you for your consideration. Now, if you have a bone spur, if the bone is really decreased in size, that could be an issue. But what I have learned, you should, and we've talked about this in other tips, do the squeeze the wrist test. And if you feel fluid between your skin and your bone, you probably are consuming, too much gluten, too much fruit, too much sugar, and you have inflammation in your body. So we have many people have very large spurs, but they don't have pain. We actually use something in our practice called Intenzyme Forte on an empty stomach, and that helps take away inflammation. I would eliminate all fruit for a month or two and see how that responds. And if it doesn't respond, you come and visit us because we have people that visit us from all over the world, and we can help create a strategy for wellness. I'm Dr. Bob DeMaria.